respond to those points. I want to begin, Commissioner Jones-Gaston, discussing the role that HHS plays in protecting foster children across the country. The Child Abuse Prevention and Treatment Act requires child welfare agencies to have procedures to receive, screen, and investigate reports of child abuse and neglect, and requires those states to include child sex trafficking in their definition of abuse and neglect. How does HHS ensure that state child welfare agencies screen in victims of child sex trafficking in practice and not just as a matter of policy on paper?
So the oversight of child welfare agencies across the country that are 4E agencies receiving federal funds from the Children's Bureau, we have a oversight process called the Child and Family Services Review. And that process is involves case review, data review, and interviews with young people, community members, parents that are involved in the cases that are being reviewed. That's the primary mechanism for oversight in the long term. States are also required to have a Title IV-E plan that they've submitted, and that includes the policies and procedures that they have in place that adhere and follow federal law and regulation, and those plans are reviewed and approved at the Children's Bureau.
I appreciate that, and where I want to press a little bit further here is having a plan or a policy documented on paper is an important start. If there are failures to implement those plans or policies, if it's policy without effective practice, then the objective of ensuring that vulnerable children are protected may not be achieved. Are there tools in statute or in practice that HHS either has or lacks to ensure, for example, that this requirement that child sex abuse cases be screened in and not screened out upon a report or an allegation, that these policies are implemented? Or do you need more tools in order to ensure that those policies are implemented?
So when the requirement came out that child abuse, that calls to the hotline that indicated concerns around trafficking needed to be screened in, efforts were made in providing technical assistance and support to jurisdictions to understand what the law is and make plans for how they were going to implement that practice. Some required state legislative action, some required regulatory action at the state level. ACF has the overarching federal rules and regulations. Each state actually runs their child welfare system and has their definition of what child abuse and neglect are. So I want to make sure that's clear. And then through the Child and Family Services Review that I spoke about is one mechanism for review. We have regional offices that do joint planning with agencies in regards to how they are implementing the requirements that exist federally, and technical assistance mechanisms that are available and provided to state agencies regarding workforce training, ability to connect with others that have already made changes in regards to those rules and regulations. And again, through the review process, or if an issue gets raised up to us, there is then the process of possibly doing partial reviews, where we're going in and seeing in a case review process if the federal rules and regulations are being followed in the actual practice on the ground.
Okay, we'll dig in a little bit more on that in a moment. First, I want to talk about children who are reported missing or who run away and are recovered. Federal law requires state child welfare agencies to have policies and procedures in place to screen children who were recovered after running away from foster care. And the purpose of that screening is to determine whether they were victims of sex trafficking and to provide appropriate services. A 2022 HHS Inspector General audit examining the records of children who were recovered after going missing from care across 5 states found that in most cases reviewed, there was no evidence that these children had received the required screening. My question for you is, how does HHS work with states to improve compliance with those screening requirements?
Well, first of all, the safety of children is priority for us. And we are working really closely with our partners in the Office of Trafficking in Persons, and just last year issued an information memorandum that identified, again, the requirements that exist, but also resources for training, and then doing technical assistance through our regional offices to ensure that states have the appropriate policies and practices in place, and identifying technical assistance in their development of the various assessment tools that they have, and in working in close partnership with our OTIP partners in regards to continuing to provide training and learning opportunities for the 4E agencies that we serve.
Okay, let's talk a little bit about NCMEC, and we'll get into this with the FBI as well, but Commissioner, under federal law, of course, state foster care agencies are required to report children missing from care to the National Center for Missing and Exploited Children, or NCMEC, as well as to the National Crime Information Center. But an HHS OIG audit from March of 2023, reviewing data collected from 46 state child welfare agencies across the country, found that 45% of the missing child episodes in the review sample were never reported by states to NCMEC. So how can HHS, and how does HHS work with these state agencies to improve their compliance with the requirement that there be reporting to NCMEC of children missing from care?
So one of the mechanisms that we've done is issue information Miranda and program guidance in regards to the requirements. And through our regional offices, then doing review to make sure that the 4E agencies have the appropriate processes in place, and offering then technical assistance in areas where they identify they need assistance in improving practice in regards to their workforce. And again, working really closely with our OTIP partners in making sure that we are providing assistance, technical assistance, and awareness out to the 4E agencies regarding the tools that are available and the technical assistance that's available, so that they can be working on improving their practice.
Let's talk about the medication of children in foster care. So to receive federal funding for child welfare services, states are required to have a plan for the oversight of prescription medications, including psychotropic and opioid medications that are prescribed to children in foster care. A 2018 HHS OIG review for a sample of foster children in 5 states found that 1 in 3 children in foster care who were treated with psychotropic medications did not receive the required treatment planning or medication monitoring. What is HHS doing? What can HHS do to appropriately and adequately monitor the use of psychotropic medication and the state policies and procedures and practices governing the medication of children with psychotropic drugs?
The Child and Family Services Plan, which is a 5-year plan that we do joint planning with state agencies in, is one place where they are required to report what their plans and strategies are for managing the care of the children that they are over. And then there are annual progress review reports that are submitted. And so through that and the relationship with the regional offices and the technical assistance that we provide, in addition to the Child and Family Services review, which is a periodic review, is opportunity for us to have conversations and dig in with jurisdictions about what their practice looks like, how they're doing, and what assistance they need to continue to improve, or if they need assistance in identifying examples of policies and procedures that they need to implement at the state level.
Thank you. And the subcommittee's heard substantial concern from advocates, attorneys, as well as former foster youth, about over-medication and the appropriate use of opioids and psychotropic medication for foster children. So we'll want to dig in a little more deeply there. At this time, I would yield to Ranking Member Blackburn.